Joan Onnen braved chilly temperatures and rain to run Race for the Cure a few years back.
These people are greasing their tushes off to come out here and raise a lot of money for breast cancer research so that that cure can be found for all phases and forms of breast cancer.
She had good reason to participate, being a breast cancer survivor herself.
She's a very, very strong, very determined woman.
Joan finished the race and started a campaign to get the word out, not just about breast cancer, but the form she was doing battle with.
It's not particularly common, but it is fairly aggressive.
Inflammatory breast cancer constitutes less than 5% of all breast cancers, but more often than not is terminal.
Inflammatory breast cancer just usually looks like infection.
The disease often first captures attention as a rash or irritation of the skin around the breast.
It was summertime. She was out mowing the yard. She thought that this rash that she was developing was just from irritation from sweating or whatever.
The cancer cells invade the dermal lymphatic channels, which are the little lymph vessels that are right in the skin. And so it feeds through there.
By the time Joan made it to Dr. Brad Lair, both knew what they were dealing with. But too often, that is not the case.
There are many doctors in this world right now that don't realize what inflammatory breast cancer is. They treat it as an infection.
Lumps that may show up on mammograms or self-exams usually aren't there with inflammatory breast cancer. So unless the patient and doctor know what they're dealing with, it is misdiagnosed and mistreated during crucial early stages.
And that if you're not responding appropriately to antibiotics, that you want to be a little proactive in perhaps getting it biopsied sooner rather than after we've had another 2 or 3 courses of antibiotics.
We gather in prayer today for Carol Joan Oman.
Joan Onnen died Thanksgiving morning last year. Now her daughter, her doctor, and her friends are determined to finish what she started.
She would finish up with a chemotherapy appointment just down the hall and come here and volunteer afterwards.
She lived 2 years full force with a disease that was almost guaranteed to kill her and was determined to bring it into the spotlight before it brought her down.
But the key thing is being aware that inflammatory breast cancer exists.
It isn't a message that we want to get out there to frighten women, but it is a message that might save someone's life.